Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Denver Developmental Screening Test assesses the developmental progress of children from birth to 6 years of age. It evaluates 4 key domains: personal social, fine motor adaptive, language, and gross motor skills. The test identifies children who may have developmental delays or disorders such as cerebral palsy, autism spectrum disorder, or intellectual disability. Its main purpose is to facilitate early detection of developmental abnormalities to enable timely intervention and support. The tool assists healthcare professionals in monitoring growth milestones and planning further diagnostic evaluations if necessary. The Denver Developmental Screening Test is indicated for children from birth to 6 years of age. It is primarily used to identify developmental delays in social, fine motor, gross motor, and language skills. The test is most useful in pediatric primary care settings, early intervention programs, and community health clinics, where early detection of developmental disorders is critical. It assists healthcare providers in determining the need for further diagnostic evaluation or referral to specialized services. The tool is effective in populations at risk for developmental delays due to prematurity, low birth weight, or socioeconomic factors. Its standardized administration and scoring facilitate consistent monitoring of developmental progress during routine well-child visits. The Denver Developmental Screening Test consists of 120 items divided into 4 domains: personal social, fine motor adaptive, language, and gross motor. The tester presents each item in a structured sequence based on the child's age. Items include direct observation, caregiver report, and elicited tasks. Responses are scored as pass if the child performs the task successfully, fail if not, and refuse or no opportunity if the item cannot be assessed. Testing proceeds from the items appropriate for the child's chronological age downward until 3 consecutive items are passed. Items significantly below the child's age are expected to be passed. Failure on these indicates delay. The results are plotted on a standardized chart that indicates age-specific reference ranges corresponding to 75th, 90th, and 97th percentiles. A score below the 90th percentile on any item suggests a suspect delay, while failure on one or more items below the 75th percentile indicates a cautionary status. Interpretation includes identifying areas where the child has difficulty compared to expected developmental milestones for their age. Referral for further evaluation is recommended if the child scores in the suspect or caution ranges. The test is designed for children from birth to 6 years of age. The Denver Developmental Screening Test demonstrates variable sensitivity and specificity depending on the population and domain assessed. Sensitivity refers to the test's ability to correctly identify children with developmental delays, while specificity indicates the ability to correctly identify children without such delays. Studies report sensitivity values ranging from 65% to 85%, indicating that the test detects a majority but not all children with developmental issues. Specificity values typically range from 70% to 90%, reflecting generally good accuracy in ruling out children who are developing normally. For example, a sensitivity of 75% means that out of 100 children with developmental delays, the test will correctly identify 75 but miss 25. A specificity of 85% implies that out of 100 children without delays, 85 will be correctly classified as normal, while 15 may be falsely identified as at risk. These metrics highlight the Denver Developmental Screening Test's usefulness as an initial screening tool, albeit with the possibility of false positives and false negatives. The Denver Developmental Screening Test was originally developed in the late 1960s by Frankenberg and colleagues as a tool to identify young children at risk for developmental delays across 4 domains: personal, social, fine motor adaptive, language, and gross motor skills. Validation studies conducted in the subsequent decades assessed the test's reliability and accuracy in diverse populations. Early research demonstrated inter-rater reliability coefficients ranging from 0.8 to 0.9, indicating consistent scoring among different evaluators. Sensitivity and specificity values varied between studies, but were generally reported to be above 80%, supporting the test's effectiveness in detecting developmental concerns. Longitudinal research following screened children affirmed the predictive validity of the test in identifying those who later demonstrated developmental impairments. Additionally, comparative studies with other developmental assessment tools have shown that the Denver Developmental Screening Test performs favorably in terms of detection rates, ease of administration, and cost-effectiveness. Despite some limitations in cultural applicability, ongoing revisions and standardizations have incorporated normative data from diverse populations to improve validity and reliability. The body of scientific evidence thus underpins the Denver Developmental Screening Test as a well-established, standardized instrument for early childhood developmental screening. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.